Good evening. My name is Matt Pulowski, and today I'll be discussing the Cybersecurity Framework for Augusta Medical Hospital. The objectives of this presentation are to provide an introduction to Augusta Medical Hospital, an introduction to the NIST framework alignment, to discuss elements of cybersecurity risk, to discuss the implementation of privacy principles, and to discuss the legal and regulatory standards and their effects. As a brief introduction to Augusta Medical Hospital, this is a hospital in Augusta, Georgia that has 22 doctors and several hundred staff serving about 10,000 patients. Some of the challenges of the hospital: they have outdated equipment, outdated software applications, and limited networking and integration. They have also been victims of ransomware targeting patient medical records several times in the past 2 years. Primary goals of the new framework are to integrate medical systems to support secure access to electronic medical records, electronic health records, personal health records, and protected health information, to increase staff efficiency with medical charting, to support access to medical insurance claims, radiology, pharmacy, and laboratory systems, and to allow transfer of electronic health records to other medical providers. Finally, there is a goal to create a secure patient portal that allows patients to view their medical records, diagnoses, and treatment plans, create and cancel appointments, pay medical bills, and view digital medical imaging. The primary goals, or the two most important goals, are to integrate the medical systems to support secure access and to allow the transfer of the electronic health records to other medical providers and to maintain security while doing these. The hospital security framework will be aligned with the NIST framework. NIST frameworks are cost-effective, applicable to all phases of this organization, and it's a comprehensive security framework. We will specifically be using the NIST Special Publication 800-66 Revision 1, which is an introductory resource guide for implementing the HIPAA security rule. This is a framework for compliance with HIPAA security rule, and the HIPAA security rule requires confidentiality, integrity, and availability of electronic personal health information. The NIST framework that we'll be using aligns our security framework with HIPAA requirements. For example, HIPAA requires administrative safeguards, physical safeguards, and technical safeguards in order to comply with HIPAA. By following this NIST framework, we will actually implement all the administrative safeguards that you can see listed here, as well as several others, all the physical safeguards listed here, as well as several others, and all the technical safeguards listed here, as well as others. By implementing all of these and following this framework, this roadmap, we'll be able to comply with HIPAA, and we will be in compliance with HIPAA throughout our process. Several of the compliance requirements that we have to follow are for the HIPAA security rule. This ensures the confidentiality, integrity, and availability of all electronic personal health information that's created, received, maintained, or transmitted. It also identifies and protects against reasonably anticipated threats to security or integrity of the information. It protects against reasonably anticipated impermissible uses or disclosures, and ensures compliance by the workforce. Another law that we must comply with is the high tech. This requires adoption of electronic health records over paper records. There are several consequences for non-compliance. First, there are organizational consequences. These are usually civil violations and result in monetary fines between $100 and up to $1.5 million per year. It also has a loss of reputation. Personal consequences, however, are different. These can be criminal violations. For example, knowingly obtaining and disclosing personal health information results in a jail sentence of up to a year and up to a $50,000 fine. Now, intentionally selling and distributing personal health information can result in up to 10 years in prison and a $250,000 fine. When discussing the elements of cybersecurity risk, it's important to understand what we're discussing. Risk is defined as the potential for damage, destruction, or loss of data and assets. Threats are something that takes advantage of a vulnerability. There can be intentional threats, which would be like a cyber attack, such as phishing, ransomware, etc. An unintentional attack, which would be an employee that left their workstation logged in and allowed someone that was not allowed to use that workstation to access data, or natural, which would be like a natural disaster. Vulnerabilities are defined as a weakness in applications, networks, or infrastructure. Now, the way to combat risk is by conducting a risk assessment. This is an overall assessment of the various systems, their potential for risk, and prioritizing the most essential systems in the organization. The way to combat threats is by threat modeling. That's doing research of common threats and attack vectors, which are constantly changing. The organizational security posture can be optimized against these common threats and can be optimized towards protecting against these attack vectors, which can increase security. And finally, to combat vulnerabilities, we will conduct penetration testing, which is used to identify security weaknesses. Other aspects of our cybersecurity risk mitigations will be access control, where we only allow the access to employees that they're required to complete their jobs. The use of a strong firewall and intrusion detection systems or intrusion prevention systems. Employee training, human interaction is involved in a vast majority of cyber attacks. So if we can train our employees on what to look out for, they can be active participants in our cybersecurity infrastructure. Physical security is important because there's going to be places within the systems, within the hospitals, that can be accessed only by certain people, because that's where the most sensitive information will be kept. Having strong username and password protocols is an important step. This allows us to monitor who has access to what information, and then also conducting regular audits and then active monitoring of the system can result or can find um, cyber attacks that have happened in the past. The privacy principles listed here are part of the GDPR, which is the European Union privacy system or privacy law. Lawfulness, fairness, and transparency, limitations on the purposes of collection, processing, and storage, data minimization, accuracy of data, data storage limits, and integrity and confidentiality. These privacy principles will be incorporated uh, into the Augusta Medical Hospital's um, security framework because, for example, data minimization. We're only going to collect the data that we need to conduct our assessments. We're going to make sure that the data is accurate and remains accurate. We're going to only store the data for as long as we need to, and then we will allow that data to be deleted. Integrity and confidentiality. Our whole framework is designed around providing integrity and confidentiality. It also incorporates availability. We want the patients who own the data to be able to access that data as quickly as possible. And then the limitations on the purposes of collection, processing, and storage. That's an important one because we're only going to be collecting the data that we need to do our jobs, and then we are going to be open and transparent about why we're collecting the data and what we'll be using it for, which is the first lawfulness, fairness, and transparency. So I've talked a lot about the legal and regulatory standards of the hospital, but I want to discuss how these legal and regulatory standards impact our policies. So as you can see from using this particular NIST framework, which allows us to comply with HIPAA, um, the legal and regulatory standards guide and inform all of our security policies. We want to be able to comply. We want to have compliance with HIPAA, and therefore we're allowing these legal and regulatory standards to guide and inform everything that we do. These legal and regulatory standards also motivate compliance. They grant benefits when you are in compliance, and then they also deter non-compliance. If we fail to comply with these things and we have data breaches going forward, these things are going to be punished with, like we discussed earlier, with a loss of public support and also monetary fines. Thank you for listening to this presentation. Please reach out if you have any questions. Thank you.